In this video, I'm going to be talking about iron deficiency anemia. So let's get started. What is iron deficiency anemia? It's a condition when the blood does not carry enough oxygen to the body due to unhealthy red blood cells. For a better understanding, let's look at the components of blood. Blood has three types of cells: red blood cells, white blood cells, and platelets, and each one has a different function. Red blood cells, they carry oxygen from the lungs to the different organs in our body, and iron is an important component of red blood cells. White blood cells protect the body from foreign invaders, so they form an immune system. Platelets are responsible for blood clotting. Conditions that may lead to anemia: heavy periods, pregnancy, ulcers of the gut, colon polyps or colon cancer, lack of iron in the diet, and poor absorption of iron from the gut. Let's look at some of the signs and symptoms of iron deficiency anemia. Tiredness or fatigue. This is the most common complaint in people with anemia. They feel tired all day. Breathlessness. On doing some activities, they feel breathless. Racing of heart. People with anemia feel their heartbeat. Recurrent infections. They catch cold easily and more frequently than other individuals. Hair loss. Sometimes it is massive. Brittle nails, which leads to cracking of the nails. Their hands and feet are usually very cold. Inability to cope with day-to-day activities, and in very severe cases there could be depression. Now, who is likely to get anemia? Premature infants, children between 6 to 36 months with a diet high in cow's milk and low in iron containing foods. Women, especially with heavy periods and lack of dietary iron. Elderly through poor diet and chronic illness. Vegetarians, athletes who lose iron in sweat. Adolescents due to rapid growth spurt. People on certain drugs like aspirin or anti-inflammatory. It causes slow bleeding from the gut, and that leads to anemia. Hookworm infestation. How is it diagnosed? Through blood tests and do a special type of study called iron studies. This is to check for circulating and stored form of iron. We look at certain parameters like ferritin. This is an iron store form, and a low level indicates iron deficiency. Transferrin saturation, serum iron level, level of vitamin B12, and folate. Now, the main problems with anemia, we discuss about that. It is not fatal, but the cause is a concern. In older adults, the possibility of bleeding from the gut due to a cancer or an ulcer must be considered. The specialist may want to visualize the gut through a procedure called colonoscopy or gastroscopy. But the good news is that the outlook is usually very good. What is the treatment? The most important thing is to treat the underlying cause. If the investigations give an all clear for bleeding, it is likely that the cause is lack of iron in the diet. Sometimes blood transfusion is necessary to correct anemia, especially if you are facing surgery. Let's look at the medication. The treatment part includes medication and diet rich in iron. Main medications are iron supplements. They can be in the form of tablets or injections. Tablets are preferred over injections. Take one tablet every day for 3 months with vitamin C for better absorption. Now, it has some side effects such as stomach upset, bloating, indigestion, nausea, constipation, and black colored stools. In children, iron syrup is given before meals and it is mixed with orange juice. Now, this can stain the teeth but drinking with a straw helps. Diet is important. You have to limit milk intake. Should not be more than 500 ml per day. Avoid excess caffeine. Eat ample iron-rich foods, especially protein. Protein foods are meat, such as beef, liver and poultry, fish, seeds of sesame and pumpkin, eggs, fruits, dried fruits such as prunes, figs and raisins, fresh fruits, juices of prune and blackberry are beneficial. Vegetables, greens such as spinach, beet and lettuce, dried peas, beans, pumpkin, sweet potatoes, grains, iron fortified breads and dry cereals, and oatmeal cereal. Let's look at the prevention. It is aimed for a well-balanced diet and with adequate iron. Give bottle-fed infants an iron-fortified formula and start iron-containing food as soon as possible. Complications. In infants and children, there could be physical and mental impairment, and it can lead to a low IQ and problems with growth. Adults, they have impaired immunity. That means they are prone to infections. Inadequate oxygen supply to heart can also lead to angina and heart attack. While elderly, due to decreased oxygen, can cause damage to brain cells, and this can cause dementia in elderly, which means they usually lose their memory. 1 in 3 women have anemia. 50% of postnatal depression is due to iron deficiency anemia, and 50% of cases of heart failure are due to iron deficiency anemia. Well, that comes to the end of my video. I hope it was helpful in understanding anemia. Thank you for listening. Don't forget to like and subscribe to my channel. Bye for now.